Welcome back to Health, Hygiene and Wellness. We are still discussing about hypertension here, and I'm having Dr. Silas, and we are discussing about it. Now, if we begin, Dr. what is the government's preparedness about hypertension in the whole of Kenya?
I can say there have been a lot of steps currently to curb hypertension because the projections are high. You said it was 10 million worldwide.
Yes.
They are saying in 10 years it will triple. In 10 years it will triple. In fact, the statistics that were there were saying in Kenya in 2030 actually we'll have double numbers that we have right now. And we are seeing it in the hospitals. If you come to my clinic today, it is swollen. I usually see almost 100 patients in a day who have hypertension. In Trans-Nzoia alone, we have almost 15,000 patients who have hypertension. 15,000 who have been known. And we are saying 30,000 out there are not known. And they have hypertension. We did a baseline survey some years back. We were surprised. Only 30% of our population, the adults, those who are above 20 years, were not having the risk for hypertension. Actually, another 20%, another 30% were having pre-hypertension. Then another 40% were having hypertension already. So you can see 70%, because these who have pre-hypertension will move to hypertension. You see the numbers when you get to systolic and diastolic. So the government has put in place a strategic plan for non-communicable diseases that is running, I think, up to 2035. It was launched recently, 2 years ago.
Yes.
Then also the government has formed a division for NCDs, non-communicable diseases, at the Ministry of Health. So we are lucky to have that because this is now spearheading the management of hypertension in the country. Because with devolution, again, policy was left at the national government level. So we depend on the national government to do policy for us. So when they do these strategic plans and many other policy documents, it will help us in nurturing doctors who can manage hypertension, in nurturing hospitals that can manage hypertension. Secondly, we appreciate the universal health care that is now taking shape. Because if we do primary health care, we'll stop hypertension. It's a stopgap measure for hypertension because you can't stop hypertension when you're just going to the community. We have to go to the community. There are people who don't even have television to see what we are talking about.
Yes.
But if we go to radio stations, if we go to barazas, if we do community dialogues, it will help hypertension. And for those who get a chance to get such information, they need to pass it over to their family members. It is so bad. It is rendering people in catastrophic expenditures because now when one of your family members gets a stroke, even if you are working in Nairobi, if it's your mother, you might stop working in Nairobi just to come back and take care of her. So it is very serious. So that's what the government is doing to prevent hypertension.
Okay, let's talk a little bit about the systolic and diastolic blood pressure.
Yeah, yes, that's a good question. When we come to the hospital, the doctor will prepare you, and many people don't know how to check hypertension. I realize that.
Can you do it yourself?
Yeah, you can do it yourself. When you walk to a hospital, the first thing, relax. You know, hypertension, many people in Kenya are always in a hurry. They want to see the doctor, they are struggling at the door, they are telling people, you have passed me and all those things. That will raise your blood pressure.
Yes.
On your day of checking for blood pressure, relax. Come to the hospital. It will only take you 15 minutes for your information. Take a seat, wait for your opportunity, then tell the doctor, I've rested for 15 minutes. Now you can take my blood pressure. Get seated in a very nice chair like this one. Let your hand rest on the table, just opposite to the doctor. Don't put your hand like this. There are people who prefer testing their left hand. No. Any hand will give you a blood pressure. And if the doctor feels this is not okay, he will still repeat a test. Then we have that blood pressure that will give you systolic and diastolic. Systolic is the upper reading. Is it the numerator?
Yes, the numerator.
The diastolic is the denominator, yes. The lower reading. Then there's another small reading there called a pulse. So the diastolic reading, the systolic, the upper reading should not go beyond 140. Then the lower reading should not go beyond 90. So it's supposed to be 140 over 90.
That is average one.
Average.
And the pulse?
The pulse should not go beyond 100.
Uh-huh.
So whenever you are testing your blood pressure, know those numbers. 140 over 90. Don't struggle.
That's a good thing. The diet, as I've said before, again starts with what you teach your children to do. You know, even in the Bible, I think there's a verse that talks about teach your child the right things and they'll never forget when they get old. Because whatever life we are living today is because of what we lived yesterday. So whatever you ate yesterday is what will bring hypertension today. So the young people need to understand that even if they like those good things, those sweet food, chips, pizza and other things, they lead to hypertension later on in their life, because we have seen obesity in young people, we have seen many other problems in young people. For the old, it is coming because of hypertension, because of age. But now, again, if this old person can take a certain diet, mostly reduce salt. Once you reduce salt, reduce fats. We advise people to take oils more than fats. Oils means the liquid oil, and probably if you want to know the liquid oil is genuine, it has to be in a transparent bottle. And a good example is Elianto. But these other ones that are enclosed in an transparent bottle, likely they just hydrogenized, they are not oils. So that's the challenge we have again. And you'll realize that the oils are very expensive. Like for example, soya and even olive oil. It's very expensive, but it's the best if you want to prevent hypertension. Number 3 is about the starch. If you take a lot of starch and you don't exercise, definitely it will move to fats. It will accumulate in the body as fats and it will lead to hypertension. So don't take a lot of ugali and many other starch, rice, mokimo, and yet you are doing nothing. You are a business lady or a businessman who sits every day. Ama wewe ni mama mboga. You sit every day. That's why you'll find that most of them are obese, because they are taking the wrong diet. And again, you have to work on your weight. You have to stop taking drugs over the counter. We say they can cause hypertension. Make sure you get a prescription from the doctor. And also you need to reduce stress. Stress has been seen to cause hypertension. Not all hypertension is caused by stress, but some cases of hypertension can be caused by stress. So stress levels are high because of the economy, but learn how to control them. Look for time, get somebody to talk to, and you will control your stress. That will prevent hypertension.
The drugs that are administered for hypertension, do they have any side effects?
Yeah, they do. Some cause, some don't. And you know, when we are managing hypertension, not necessarily that do we use drugs. At times we can use diet and physical activity. And by the way, physical activity is different from exercise. Exercise has to be programmed. If you are saying, I want to do exercise every day at 7, you must exercise every day at 7, from 7 to 7:30, 30 minutes. So note that the other day is 8, the other day is 7, the other day is 9, the other day you miss. That's not exercise. For the drugs, now a doctor will decide when to give you drugs. If you have severe or moderate hypertension, they'll give you drugs. They do have side effects, but again, when you experience any side effects, instead of stopping, come to the doctor, because we have over 1,000 drugs that can be used to treat hypertension. So we can change to the right appropriate drugs. They are different because they have different working mechanisms. So if a drug is causing you to urinate a lot and you are not comfortable, let the doctor stop it and give you another option that doesn't cause the urination. There are drugs that can cause a lot of coughing. If you are coughing a lot and you are on hypertension medicines, come to us. Let's change. There is an alternative that does not cough, does not cause the cough.
So
yeah.
The side effects are manageable.
They are manageable, and the easiest way of managing is changing the drugs. But some people tolerate those side effects, like headache. You know, most drugs for hypertension cause headache, but once you get used to them, after some time, you get out of the headache. And there are people in the community who say that when you start on hypertension drugs, you will never be stopped, and they are making our people not to start on hypertension. What will you benefit when you lose this person after getting a stroke? Stop spreading the wrong information. We doctors understand there are patients who can start on hypertension drugs and stop. So there are people who fear, anakukataza, anakwambia daktari, don't start me on any drugs because I've been told if I start on these drugs mwili itazoea. Nothing like that. If you have hypertension, you have hypertension. It has to be treated. If you don't treat it, it will cause problems. And people come to us when they already have that stroke. That's the time when they're accepting that, now daktari, give me the drugs. For what? You already have a stroke. In fact, when you have a stroke, we rarely give you drugs for hypertension because it will worsen the situation. What we do is just try to manage the stroke that is not even treatable. So the people we want to come to us are those people who have hypertension and they are not on treatment because they will eventually definitely get a stroke. So don't fear. People fear that when you start on drugs, I'll never stop it. But who said? The fact is, that's not a fact. That's maybe a myth. The fact is, if you have hypertension and you don't start on treatment, unfortunately, it will cause a complication, and this complication will make you use the drugs by force at the wrong time. Yeah.
Let's get to the May measurement now.
Yeah. Thank you. For the May measurement month, we usually observe that worldwide. Yeah, we have what we call the Kenya Cardiac Society. They are looking to prevent cardiovascular diseases, and we encourage people in the month of May, starting from the first day of May. We have been doing a lot of awareness. Just to walk to the hospital with your whole family. Your is it nuclear extended family?
Yes.
From your grandparents to yourself. Walk to the hospital, tell the doctor that we want to see how our blood pressure is, and it is free of charge. We don't pay anything to test your blood pressure, whether you are sick or not, whether you are drugs or not. You know, when we tell people to test their blood pressure, again, they are very funny. They tell you, now mama, you go, you are the one who usually has hypertension. Ama wanasema your sister wewe ndio kuna ma stress mingi, mimi sina stress. No, hypertension is not stress. I said it's for all of us. If you are talking today because you have blood pressure, and you have to make sure it is normal, so that you continue talking. If your blood pressure is not normal, it will make you stop talking, my brother. Yeah, because if you get a stroke, it renders you dumb. You don't talk. So if you want to continue talking and telling people that when the upime pressure, when you're gonna stress, come to us. Let's confirm if your blood pressure can sustain you to continue talking for the next 10 or 15 years. That's how funny it is. So for the May measurement month, we encourage people to just come to us. We don't charge, both private and public hospitals. We will not charge you to take your blood pressure. And I will really appreciate even Huduma centers. If you walk to a Huduma center, any Huduma center close to you, there's a patient there's a person there who will take your blood pressure and BMI free of charge. So it's just you to go in. It will take you 10 minutes, you are out. Yeah.
Is it something that is happening only in Kenya or worldwide?
Worldwide. The WHO, it's an initiative of the WHO, because we have the World Hypertension Day. I think, I don't remember the day, but it's World Hypertension Day also in May, and there's May measurement month. So this May measurement month, we want people to come to us. We will teach them how to prevent hypertension, and if you already have hypertension, we'll give you treatment to prevent complications. Yeah. Yeah.
Now, maybe Daktari, your concluding remarks for someone watching us right now.
My remarks are, today we are losing lives because of hypertension. Even you in the village, wherever you are, you can see it. We are losing lives. There are people who are just dying suddenly. If you ask, they tell you it was because of blood pressure. We can change this. Let people come to us. As long as you are above 20 years, every year, make sure you test your blood pressure. Number two, if you also have a risk factor, like there's a member of your family who has hypertension, make sure check your blood pressure. We can prevent the effects or the complications of hypertension by screening. Number 2, let's check on our lifestyle. We have really changed. People are not exercising. People want the white collar jobs, and these white collar jobs keep you on a chair for a long time. Make sure after you are leaving your office, go to the gym, make a run in the morning, just to prevent hypertension. Throw away all those salt shakers because they'll lead to hypertension. So make sure that you don't use raw salt. And lastly, high thresholds of stress can lead to hypertension. So make sure that you control stress. Yeah.
Wow. Thank you so much, Dr. Silas, for sparing time to talk to us about hypertension. I hope that anyone who is watching right now has information about what hypertension is and how they can prevent it. But above all, remember that this month of May is a sensitization month for hypertension, and I hope that by the information given to us by Dr. Silas is that we should find the nearest hospital, the nearest health center to be screened, and also to find out our blood pressures to know if we have hypertension or not. My name is Barasi Saenyi. Until we meet next time for health, hygiene, and wellness, it's been great having Dr. Silas. Bye-bye for now.
Thank you.